Hello, and welcome to our Strasz Assessment Systems podcast, Beyond the Test, Strasz Talks. I'm really excited for our topic today. We're going to be diving into the use of virtual reality and augmented reality in the area of education and assessment. And I'm really excited to have Jeremy Carter from SentiraXR, excuse me, Jeremy, on the call with me. And indeed, this has been a subject that Jeremy and I have collaborated on before. So it's great to see you again, Jeremy, and welcome to the podcast.
Hi, Rory. Great to see you.
And Jeremy, would you just give a brief introduction for those in the audience who might not know you?
Sure. Yeah, my name's Jeremy Carter. I'm the CEO of SentiraXR. We're a virtual reality software development company over here in the UK, primarily working in healthcare and healthcare education.
Fantastic. Well, as I always do on this podcast, I love to hear about people's career journeys because, of course, in the assessment industry, they go about 1,000 different directions. So tell me more about yours and what took you into the world of assessment and education.
Well, yeah, gosh, it's been a long time now, Rory. It's been a long time. So over 25 years, and I think So my first role in assessment technology was with Question Mark, and I didn't really know what it was before I read the job advert, and it was just something that jumped out at me. And it was the use case. Essentially, it just grabbed me immediately. Having obviously gone through many different exams and certifications where my hand was kind of dropping off after writing for hours on end, the concept of being able to computerize that process was just made sense to me. And that was way back in 2001 that I joined Question Mark, and really haven't looked back since then. It never the assessment industry kind of never let me go. But that was because there was always something kind of new and fresh and exciting that we were working on. And I think, as well, as much as I love working with technology, the fact that it's meaningful has kept me in the industry. So because of what we do has such an impact on people's lives, certification and education is the key to unlocking people's futures. And so when you combine that passion with obviously technology, you can achieve great things and help people achieve great things. So that was kind of always been my primary driver. And luckily, we work in an industry where that is a very strong kind of common ethos across all vendors. That's what people are in the industry for, and I think we should count ourselves very lucky for that. We all have a common goal and common vision, and yeah, that's always that strive for innovation within that field has kept it fresh and exciting for many years. And I think that's why I'm still around, and long may that continue.
Well, I couldn't agree more, and certainly that's been part of the appeal to me of the continued involvement in the industry. So just love hearing that. And I mean, in this area, I know firsthand, your passion around the use of AR and VR in assessment. I think back fondly to our joint presentation at ATP MIA in Oman. One of the last big international trips that I took before COVID. So certainly sticks with me. But what originally fueled your interest in using this technology in learning and assessment?
So, well, actually, I wasn't hugely kind of aware of VR beyond kind of as it started to be used in games and what have you. And I hadn't really put on a headset and engaged with it a huge amount. And it was by chance, essentially. I was doing some consultancy work for the University of Manchester, and they said, "Oh, we've got a couple of our academic guys who are exploring using virtual reality for learning, and they'd like to talk to you about." Is there a market for this, and so on and so forth. So I spent a bit of time with them, and that's when I kind of had the light bulb moment, I suppose, because they were, quite rightly, they were trying to fix a problem that was occurring within their institution of scaling difficult to teach aspects of healthcare, and unblocking the barriers to that, which is time and resources, having to repeat sessions because you can only get certain numbers of students around a hospital bed, hiring in actors, and so on and so forth. So they were trying to solve some of those challenges. I think the timing was really interesting, like you say. Kind of pre-pandemic. That's when those conversations kind of started. And then everything stopped for a couple of years because mainly because obviously we couldn't access any healthcare people because they were too busy saving people's lives, and during
Indeed.
the pandemic. So when we started to come out of that period, we picked it up and started to look at it again and say, okay, right, given the lessons that we're just learning from the pandemic, where can this technology have an impact? And for me, it was, with my background, obviously, I could bring that assessment lens to it and say, okay, look, yeah, this is so cool for, we can do a lot in terms of learning, but hey, guess what? Pretty soon, everyone's going to want to measure that learning, and because this is an investment, this is a change management program, moving away from or complementing traditional methods of training. You've got to be able to demonstrate that it has a positive impact, and that's where assessment comes in. And it's not just about the learners and the students and proving that they know what they can do, but there's a whole scope here for, are we actually assessing and training people in the right way, and are there better ways? Can we augment that process by utilizing technology such as this, and can we over time measure its effectiveness and potentially show that actually what we can do is produce better trained, in our case at the moment, healthcare professionals? And I think we can. It's a journey to get there, but that's definitely something that we have at the front of our minds as we're working on our products and systems.
Well, couldn't agree more. And before we started the call, you and I were talking a bit about our kids and their use of this technology. And of course, I know a lot of individuals watching are going to immediately associate this with the experience of either themselves or their children with gaming and the gaming industry. But it certainly has a really well carved out niche in education and assessment. Would love for you to just share with those watching, really what's Sentira's approach, and how have you worked to partner with organizations to roll out this technology in the area of education assessment?
Yeah, sure. So the way that we've approached it is, again, because there's certainly in the UK, and I'm sure that this mirrors to a pretty large extent in the US, for example. That training healthcare professionals is challenging, is difficult, it's expensive, and it takes time. All of which is good because we need to have well-trained healthcare professionals. They do a really important job. So understanding where the challenges are for those institutions that are responsible for that was our first port of call. So before we even kind of wrote our first line of code, we started talking to a group of universities, higher education institutions in the UK, and said, look, what are your major challenges? What is it that kind of gives you a real headache? What is it that makes it difficult for you, that you think is unnecessary as well? And we had a real strong common theme that came back, which I kind of touched on earlier, which is along the lines of, okay, we have limited space, we have limited kind of physical resources in which to simulate healthcare situations, and we have limited people to train that. And for example, a cohort of students having to go through a bedside consultation with a patient, that team of lecturers has to repeat it up to 60 times in order to get through the cohort, because they just can't physically get people, all of those students around a bed. They all have to take their turn. And that, is an inefficient use of those teachers and learners, teachers and trainers' time. And that was something that they were really struggling with, and they were looking for solutions that were able to maintain the authenticity of that situation. So again, this is where it kind of plays back into all the things that we talk about in assessment. Authenticity is obviously one of those key tenets of good assessment. So as soon as they started talking about this and saying, well, we need it to be authentic, we need the students to feel like they're in real life. Now, I had a bit of an issue with that at the time, because they were working with standing around a dummy with someone behind a screen voicing the dummy. Now, for me, that doesn't feel particularly authentic. However, it's a tried and tested solution, and it's used ubiquitously across healthcare training for very good reasons. But it was the scale of that was the issue. So that's what we started to look at. Is okay, right? Well, you've told us what your issues are. We're interested in sort of virtual reality as a technology. How can we bring this to bear to help solve some of these issues? And then the way that we did that was with our favorite words at the moment, artificial intelligence, and that was to combine the immersive possibilities of VR. So putting people into a simulated environment that feels kind of like real, feels so it's something that they recognize. Yes, I am in an ER room, because all of the sounds and the equipment and the machines and the noises that I'm hearing are exactly what I would be hearing in that environment. And well, guess what? There's a patient in front of me that needs some help, and I can talk to. So that's what we were kind of doing. So that all came from those conversations with those institutions. Now, as your question was, how do we actually work with those institutions to get these programs going? And we approach it very much, it's a change management. This is a big leap of technology. And again, lessons that I've learned throughout my career in assessment and assessment technology is change management is something that you need to manage very carefully. So you have to take all of the stakeholders, find out who all the stakeholders are, who's going to be impacted by this. So that is the learners, that is the teachers, that is the IT people, that is the facilities team. Who's going to maintain the equipment, who's going to clean it, all of these things. It's a change management program. So just by saying, okay, we've got a cool piece of tech, here you go, have a go with it, that's only going to get you like 1% of the way down the road. So we take a lot of time taking those institutions through that change management process and saying, okay, first things we've got to do is we've got to show success. How do we show success? Is that we start small and we pilot. And we have very clear success criteria. What is it that we're trying to achieve by doing this pilot? What is it that we're trying to show, and how are we going to do that? And then you then have the evidence base to take to the higher up people in the faculty or within the institution and say, this is what we're doing, and this is the impact that it's had, and this is what we'd like to do next. And that's seems to be working quite well for us, and obviously for our customers and obviously the students at the moment. And that's an approach that I've taken from my career in assessment.
Well, you brought out a couple things that I just love that you've highlighted. Number one, I mean, the take on authenticity, I think is fantastic. I know in the time that I spent with the Performance Testing Council, we typically framed it as fidelity, and just that emphasis on how as we make performance-based education scenarios or assessment, how that can be as high fidelity to the actual work environment as possible. I mean, secondly, my gosh, I think all of us, knowing some of the shortfalls that we have in both the US and the UK healthcare system with regard to workers, I mean, my Lord, I certainly can see the need and applicability there, just from firsthand experiences as well as those of friends and family. With the change management, just to double click on something quickly. First off, I mean, fantastic that you're thinking about this to the depth. I hadn't even, contemplated, who's going to maintain the equipment, but indeed, really, really critical. I think one thing that's come out in a couple presentations on the move to AR and VR has been just the degree of training for the participants and really what it might take for them to adapt a task that they would perform in real life or in person, and transferring that to the VR environment. How have you all observed that? Is that change differential decreased? I mean, really, what's been your process to work through some of that as well?
Yeah, I think one of the things that with healthcare, let's just take, and I'm more than happy to talk about other use cases as well, Rory. So forgive me if I keep coming back to healthcare, because obviously that's where we came from, and that's the majority of the work that we're doing. But the thing with healthcare is that almost every interaction that you have with a patient is process driven. So, even if the simple things that like taking a blood sample and what have you, there's a very strict kind of process and procedure that you follow in order to do that. That works to our advantage, because what we can do is we can build those simulations that follow a process. And so we know the steps that a learner and a candidate need to take, and we know the order in which they need to take it. So building the rubric in the background is actually, relatively, I'll stress the word relatively, straightforward, because it is generally following process. Now, the power comes in when you build in the personal human interaction into that, or combined with that process, because that is what happens in real life. When you might be wanting to take someone's blood, they might not want you to, or they're asking you questions while you're doing that. What is this for? Why are you taking? How ill am I? Oh my God. I'm gonna, this is horrendous. I feel so ill. Why, and so on and so forth. And also, there's a lot of evidence that shows that, mistakes that happen within medical care can be traced back to initial conversations between a healthcare worker and the patient by either not asking the right questions, not listening to the responses properly, and going off down a road that is not actually what's needed. And that's where malpractice, negligence, claims, and so on, that they typically stem right back to those initial consultations, because that information that is gathered at that point flows through the system, flows through into the next healthcare worker that is dealing with that patient. Okay, this is what I'm dealing with. Well, if that initial thing was wrong, then you're in the patient's not in a great place, and neither is the healthcare system. And so for us, it's being, bringing those two things together to be able to talk to the patients, understand what's going on, use your clinical reasoning, higher order skills, as well as being able to perform, sometimes routine, mundane tasks. Other simulations that we produce are about saving, literally saving lives there and then, and building the muscle memory for how to do that in a safe, controlled environment. Because we all know that we learn through practicing. So giving people the ability to practice that. And you can't you can't bring in some students and say, right, okay, there's an emergency situation, quick, we need to get the students down so they can see how we're dealing with this emergency situation. We need to find other ways of doing that in safe, controlled, in a safe and controlled way, and that's what we're all about.
Well, I'd love to hear that, especially we've all seen the dramatization of, a doctor on TV running their first code. And, certainly that kind of rehearsal of those types of emergency situations, I can certainly see the impact and the process-driven aspects reinforcing in that training process. Well, I did a little bit of research, and I must say, I was a little bit surprised just by the current projections for growth. Right now, the VR industry is supposed to grow 20% on the US side of the pond here this year. And indeed, there's estimates, they vary a bit, but more than 170 million people, depending upon which source is quoted, using VR, with US, China, India, the UAE, and France really using it quite a bit in the educational process. So with that kind of pipeline coming through, how have you really seen that impact your work in education and assessment?
Yes, good question. I think we're spending less time explaining what it is. So certainly when we started on this journey, that was very much things that we were doing. Okay, what is this? We don't have that anymore. It's much more accepted as a technology that's around. So now it moves into those questions, that we're having with people are, okay, so we understand kind of the principles, what it is, but it's more about, well, what can it do for us? And how can we do it? And how do we show, and how do we run it? That's the sort of interaction that we have with people now. So that for us, that's a great sign, in that we're not having to educate the market, as it were. The market is it's not, obviously, clearly it's not just us and healthcare. VR is being used, we've talking about kids. My kids both, they went out and got their own headsets, because when I got a headset, I was like, no, you can't, this work. So they, they had a go, and from that they went and got their own headsets. So it's technology that more and more people are becoming familiar with. And I always, if I do a talk at a conference, first of all, so a few years ago, 2 or 3 years ago, it would have been hands up if you've used VR. You'd get a handful. Now, pretty much everyone. puts their hands up and says, yes, I've had a go. And then how many of you have had a go on something that isn't a game? Again, 2-3 years ago, nobody put their hand up. They'd only just used it for a game. Now, everybody has had some kind of experience outside of gaming in VR. The majority of people that I speak to at conferences. And so that we've really been able to see that shift. And I think that's backed up by some of the figures, obviously, that you're talking about there, Rory. So the conversation has changed. And that's the biggest thing. And I think what was really interesting, it was the big thing. Up until around about October 2022, it was, the metaverse. It was, we're all going to be living in headsets, and that's, the tech giants expected us to be, working and living in these things. And then something else happened in October 2022, and it kind of, there's a perception, I suppose, that it got pushed to one side. Well, it didn't. It just the hype went elsewhere, and so it's I think those figures that you talk about show that it didn't go away. The metaverse and whatever hasn't dropped off a cliff. It's just more gone into it's not the new kid on the block, and it's continuing to be able to do its thing in its own time now. And then artificial intelligence is the thing that's kind of taken over the hype machine, quite rightly, and understandably, because that actually changed our business completely as well. It made the work that we were doing with AI a lot easier. And again, getting people to understand what we were talking about when we mentioned artificial intelligent patients. What are you talking about? Now, that was before October 2022. Now everybody gets it straight away. So,
well, what's impressed me about the work that you are doing at Sentira is you've continued to branch out and find some new uses, and indeed, quite conveniently, you recently released the results of a new study where you were looking at the use of AR and VR in, or I should say VR, excuse me, in collaboration and patient planning. So would love to hear more about that study with the University of Manchester and the National Institute of Health and Care Research.
Yeah, this is a really cool project, really cool piece of research, and I do actually feel blessed that we come. Kind of working with the University of Manchester, which has such a strong research ethos behind it, that we're able to participate in really groundbreaking, cool research projects. So this project, I find really exciting because, again, it has all of the things that I care about at its core. So, cool use of technology, but for a good purpose. And this was a project to look at the fact that, multidisciplinary teams, when they come together to talk about a patient care plan, that is being traditionally, all gathering in a room together. And then that moved on, now we can do it over a web conferencing platform. But the drawback of that is that these consultations between healthcare professionals across different disciplines of health involve a lot of very precise kind of medical data and images, and so on, scans and et cetera, and for everybody to be able to see that in depth and to be able to properly discuss, what is it that we're seeing here in this patient, and how can we come up with the best care plan for them. So that was the principle behind the research. Is there a way that we can facilitate that using virtual reality? And so what we built with, and that was it's the University of Manchester's NIHCR in the UK, and also in Kuwait as well. And in fact, the lead researcher she's a doctor from Kuwait. And what Mariam, sorry, was saying was, can I get people who are perhaps in Kuwait City and people who are in Manchester who are experts in care? So one of the use cases that we looked at was cancer care, and we can get those healthcare professionals in those two disparate locations in a virtual room together. And the benefit is that they can see each other. They will have their avatar. They can talk to each other. And what they can do is that we can bring up the 3D images and scans of this patient. And each person can then manipulate those and look at them and spin them around and do all of those things, and they can have that that proper consultation. We have whiteboards in there, so you can get up and you can start writing on a whiteboard, and it captures notes and so on and so forth. And what the study showed was, okay, what this has the potential to do is to make that process far more efficient. Instead of flying someone from Kuwait to Manchester or vice versa, clearly that's not a particularly efficient use of time and resources and money, as well as the environmental impact. It takes time as well, and so this is patient care. We can gather people into these virtual meeting rooms at the drop of a hat. And they can discuss the patient needs and come up with a care plan in a lot more effective manner. So that was the first stage of this research. I'm sure we're going to be following it up further, but the initial results from that were really positive. So I think it's a use case that we'll definitely be pursuing in a not too distant future.
Well, as we begin to wrap up here, Jeremy, I think the final question I wanted to ask is just for those who are watching and said, okay, well, this is all well and good, but what does it mean for me? We know our assessment professionals, our assessment colleagues, who, hey, what we're doing works, and if it's broke, don't kind of fix it, type of mentality at times. So, for those who are listening today who may not have thought about this use, what types of situations? Certainly, of course, you've elaborated on some great ones in healthcare. What types of use cases do you see being the best fit for this, educational and assessment methodology?
Yeah, sure. I mean, for us, we look at this where there's any process-driven task. So you're looking at engineering, you're looking at health and safety, occupational health, and so on, and communication. Anything where there's a communication skill. So we've had conversations with business schools who are want to put their students into kind of business type situations and deal with people within those situations and information, and interpret the information and be able to kind of process it and then be able to explain it within those scenarios. And we've also had conversations with finance around ethics. So ethics is a pretty difficult thing to assess, in a written way. So we've had conversations. Okay, well, you are presented, you get some information. You're within a work environment, for example, and there's an email there. Anyway, you get information, and it basically should trigger an ethical dilemma for you. And what do you do in that situation? So you may have to go and talk to the CFO. That conversation you've got to be able to manage. And so, yeah, those are all skills that communication skills, critical thinking skills, alongside practical skills of following or understanding what a process is and or a task is, and taking the right steps to perform it. So there are many industries where that is relevant, and I think there are some really good examples of VR being used in, for example, in warehouse training, and so on and so forth, where health and safety is obviously paramount. But any environment, oil rigs, all of those things where actually doing something and doing it correctly is really important. And I think that's where we'll see this technology being deployed increasingly over the coming years.
Well, Jeremy, I so appreciate you taking the time and sharing some of your experience and wisdom here with us.
It's a pleasure, Rory.
And I hope for all of those who have listened, first off, thank you for your time. And I hope this was fruitful. And certainly we're going to continue to track how VR and AR continue to evolve, and particularly in this industry. I think it's fascinating and has quite a few endless possibilities. So with that, for our listeners, I look forward to seeing you in 2 weeks on our next episode. And once again, thank you for Jeremy, for your time and for being on the podcast.
Thanks, Rory. Great to speak to you, as always.
Take care, all.